Antibiotics are among the most misunderstood medications people try to prepare for emergencies. In many preparedness communities, the idea of stockpiling antibiotics comes up often. The reasoning seems simple: infections can happen anytime, medical help might not always be available immediately, and antibiotics are powerful tools against bacterial disease. But the reality is more complicated than most people expect. Antibiotics are not general-purpose medicines. They work only against specific types of bacteria. Using the wrong antibiotic or using one at the wrong time can make a situation worse rather than better. That is why most doctors emphasize that antibiotics should always be used with professional guidance. Still, when people discuss medical preparedness, antibiotics tend to appear again and again in conversations. They are commonly mentioned because of their long history of use, broad coverage, and availability in many parts of the world. Understanding why these four are often discussed can help clarify how antibiotics actually work and why they are not something to treat casually. The first antibiotic that often comes up is amoxicillin. Amoxicillin belongs to a group of antibiotics called penicillins. It has been widely used for decades and is commonly prescribed for infections such as ear infections, certain respiratory infections, sinus infections, and some dental infections. Because it treats a range of common bacterial conditions, many people assume it would be useful in emergency situations. However, even this familiar antibiotic does not work against every infection. Some bacteria have developed resistance to penicillin-based drugs, and some people have allergies that make these medications dangerous. In addition, many illnesses that seem bacterial such as sore throats or coughs are often caused by viruses. Antibiotics do nothing against viruses. The second antibiotic people frequently discuss is doxycycline. Doxycycline belongs to a class of antibiotics called tetracyclines. It is considered a broad-spectrum antibiotic, meaning it works against a wide variety of bacteria. Doctors sometimes prescribe doxycycline for respiratory infections, certain skin infections, tick-borne diseases, and other bacterial conditions. One reason it is often mentioned in preparedness discussions is that it has a relatively long shelf life compared with some other antibiotics. But like all antibiotics, doxycycline must still be used correctly. Incorrect use can lead to resistance, side effects, or incomplete treatment of an infection. The third antibiotic often mentioned is ciprofloxacin, sometimes called Cipro. Ciprofloxacin belongs to a class known as fluoroquinolones. These antibiotics can treat certain serious bacterial infections, including some urinary tract infections, gastrointestinal infections, and other conditions. Because of their strong antibacterial activity, they are sometimes viewed as powerful emergency medications. However, fluoroquinolone antibiotics also come with important safety considerations. In recent years, health authorities have issued warnings about potential side effects involving tendons, nerves, and other systems. For this reason, many doctors reserve them for situations where other antibiotics may not be appropriate. The fourth antibiotic that people sometimes discuss is azithromycin. Azithromycin belongs to the macrolide family of antibiotics. It is commonly prescribed for respiratory infections, certain throat infections, and some bacterial diseases transmitted through contact. One reason it appears frequently in preparedness discussions is its relatively simple dosing schedule. In many cases, treatment courses are shorter than those of some other antibiotics, but simplicity does not mean it is appropriate for every infection. Like all antibiotics, azithromycin works only against specific bacteria and must be chosen carefully. When people talk about stockpiling these four antibiotics, amoxicillin, doxycycline, ciprofloxacin, and azithromycin, they are usually thinking about broad coverage. Each of these medications targets different groups of bacteria. Together, they represent several of the major antibiotic classes used in modern medicine. However, this way of thinking overlooks an important reality: antibiotics are not interchangeable tools. Treating bacterial infections correctly requires identifying the likely cause, choosing the correct antibiotic, and using the correct dosage for the proper length of time. Using antibiotics incorrectly can cause several problems. The infection may not be treated effectively. Side effects may occur. And perhaps most importantly, improper use contributes to antibiotic resistance. Antibiotic resistance happens when bacteria adapt and become harder to kill with existing drugs. This problem has become a global concern because it makes infections more difficult to treat over time. That is why responsible antibiotic use is such an important part of modern medicine. Another challenge is that many conditions people assume are bacterial are actually viral. Colds, flu, and many respiratory infections do not respond to antibiotics at all. In those cases, taking antibiotics offers no benefit and may expose a person to unnecessary risks. So what is the key insight here? The most important part of medical preparedness is knowledge and organization, not simply collecting medications. A well-prepared household focuses first on prevention, hygiene, wound care, and early treatment of minor injuries. Proper wound cleaning, sterile bandaging, and good hygiene practices can prevent many infections from developing in the first place. Medical preparedness also involves understanding symptoms that require professional care. Serious infections such as high fever, severe swelling, spreading redness, difficulty breathing, or confusion should always be evaluated by medical professionals whenever possible. Antibiotics are powerful tools when used correctly, but they are only one part of a much larger medical system. Preparation should focus on building that system: basic first aid supplies, organized medical information, access to reliable guidance, and an understanding of when professional care is necessary. When people approach medical preparedness in this structured way, they make better decisions and avoid many common mistakes. Antibiotics should never be treated like ordinary household supplies. They are specialized medications that require careful judgment. Understanding that distinction is one of the most important steps in responsible preparedness. If you found this explanation helpful, consider subscribing to the channel. The goal here is to break down complex preparedness topics into clear and practical ideas that everyday households can understand. And if you want to explore medical preparedness in more detail, there is a helpful resource linked in the description that explains home medical planning and emergency treatment strategies. It can serve as a useful reference for building a more complete and organized household medical system.